Why this tool? Expertise France and the 5% Initiative consider gender to be essential to cooperation and work to include gender in all their actions and in particular in technical assistance missions. This tool has been developed for technical experts to integrate minimum gender criteria into their missions. This 5% Initiative gender-based approach should be linked with strategies developed by other key players. Let's start with a definition of the term. Gender refers to the power and social relations constructed between men and women. In our societies, these relations are disadvantageous to women. Gender is constructed by society. It relates to the roles assigned to women and to men, as opposed to sex, which refers to biology. Both women and men can be affected by these gender roles. A project that targets women may not be a gender-based project. A gender-based project targets power relations between men and women and other gender-fluid people, and tries to make these relations more equal. Women's projects target women only and often fulfill practical needs and not strategic ones. For example, paying for women's travel to the health centre is a practical need and does not improve the unequal relations within a couple so that they both take part in health decisions, which is a strategic need. Why integrate gender in development and healthcare projects? In a pandemic situation, gender and unequal social relations create people's vulnerabilities and create obstacles to healthcare services. If gender is not considered in a project, there is a risk of aggravating existing inequalities, and the project may fail to improve the target population situation in a sustainable way. An example could be a project that targets women only and encourages them to take their children to a tuberculosis screening campaign. If women do not take part in decisions about the family's health, there is very little chance that the impact of the project will be as expected. It adds to women's domestic and mental burden and reinforces the stereotype that childcare falls to women. How are pandemics and healthcare systems affected by gender? Regarding HIV, many women and girls are unable to insist on condoms during sexual relations due to an unequal balance of power. In addition, gender norms encourage men to be strong and virile and not to show any signs of illness. This is one reason why they are not present in greater numbers in HIV healthcare centres. For malaria, gender norms concern domestic tasks that take place outside and expose women to mosquito bites when cooking or fetching water at dawn or dusk. The same applies to men working in forests and mines at times when mosquitoes are most active. For tuberculosis, gender norms affect men depending on their job, such as miner or soldier. But in some contexts, access to anti-tuberculosis services is harder to achieve for women, as their health is considered to be less important than men's. And often women who are victims of violence, or transgender women and transgender men, may suffer from significant discrimination, which can prevent them from seeking medical care in health centres. To integrate gender into your technical expertise missions, you can ensure that gender is included in healthcare policies, that women are present and able to express their views at your workshops, the availability and quality of drugs that are specific to each population. For example, contraceptives for young girls. This video is accompanied by 3 modules. The first develops the main gender challenges for the 3 pandemics and the different populations. The second looks at the key gender questions to ask for the technical assistance you provide, governance, access to high-quality medication. The third covers gender in your mission methodologies, from workshops to writing reports.